Have you ever been told if you only binge on the weekends, you don't have a problem? Or that addiction is a choice? You could quit if you really wanted to? These aren't just myths. They're beliefs that can prevent people from understanding the real nature of substance use disorders. Hi, I'm Dr. Andrew Smith, psychiatrist at the Ottawa Hospital, assistant professor in the Faculty of Medicine at the University of Ottawa, and a clinician investigator in the neuroscience program at the Ottawa Hospital Research Institute. In this video, I'll be debunking 6 of the most persistent myths about substance use disorder. Before we dive into these myths, it's important to acknowledge that myths often persist because they contain a small kernel of truth. For instance, someone may choose to try a substance initially, but developing substance use disorders goes far beyond a simple choice. Understanding this nuance helps us to better address and debunk these myths effectively. Myth number 1. Some people believe that substance use disorder is a choice and that people can quit at will. Substance use disorder is not about willpower. It's a medical condition that alters the brain's reward and impulse control systems. While the initial choice to use a substance may be voluntary, changes in brain chemistry make stopping much more difficult, requiring medical and therapeutic support. The initial decision to use does not mean that developing the disorder is a choice. Some think that trying a drug once is enough to get someone addicted immediately. Substance use disorder typically develops over time and with repeated use. Many people try substances, whether recreational drugs or prescription medications, and don't develop a disorder right away. Factors like genetics, environmental influences, and mental health conditions all play a role in how quickly addiction may develop. While substance use disorder doesn't usually happen after one use, each use increases the risk of developing a substance use disorder. For example, drugs like opioids or cocaine can cause changes in the brain's reward system very quickly, leading to compulsive use. It's true that avoiding substance use entirely reduces the risk of developing a substance use disorder. But trying a substance does not seal a person's fate. Each person's path to substance use is multifaceted and often involves a mix of genetic predisposition, environment, and mental health factors. There's a belief that people with substance use disorder need to hit rock bottom, lose their job, damage their relationships, or face a huge crisis before they'll be ready to get help. Rock bottom is not only misleading, but also stigmatizing language that sensationalizes an extreme low point, such as being unhoused or begging for money, as a necessary stage for seeking help. This misconception suggests that only those who reach this stereotypical rock bottom are worthy of help, which can prevent people from seeking support early on. In reality, the moment someone recognizes they need help is unique to each individual and does not need to be a dramatic or extreme crisis. Intervening early can prevent deeper physical, emotional, and psychological damage. Many people think that using substances only on the weekends means there's no real issue. However, even sporadic binge use can still have serious consequences, like accidents, poisoning, and increased stress on the liver and the heart. What's less known is that binging can meet criteria for substance use disorder if it begins to interfere with functioning in other areas of your life. It's a common belief that the substance use crisis would be solved if we just eliminated drugs and drug dealers. This quick fix approach has been attempted before, most notably during the war on drugs, and it has failed. Substance use is not just about the availability of drugs. It's about deeper underlying issues like trauma, mental health, poverty, and social isolation. Criminalizing drug use and focusing solely on eliminating substances drives the problem underground, making it harder for people to seek help. It's critical to focus on addressing the root causes of substance use disorder, like mental health and trauma, rather than assuming that limiting the drug supply will solve the problem. Some believe that harm reduction programs, like supervised consumption sites or needle exchanges, encourage use by making it easier for people to access clean needles or a safe place to use. Harm reduction doesn't enable substance use, it saves lives. These programs reduce the risk of overdose, disease transmission, and other health complications. However, harm reduction is most effective when paired with access to treatment and support services. It's not just about keeping people alive, it's about creating opportunities for individuals to engage with treatment and recovery services when they're ready. By dispelling these harmful myths, we can help break the stigma around substance use disorder and encourage more people to seek the support that they need. Remember, stigma is not just about the words we use, but also about our underlying attitudes. It's important to approach these conversations with compassion and understanding. If you or someone you know is dealing with a substance use disorder, reach out to a healthcare provider for help. Recovery is possible with the right treatment and care. Thank you for watching.